I went to one of my doctor's appointment, and all of my gender markings have been, of course, changed to F. I guess a staff person saw fit to go in without any questions to me, any questions to me or my doctor, and just went on and changed it back to M. And I was with my husband at the time. He was with me when we had came to the appointment, and they called me by my old gender marking, and it was and I felt disrespected, hurt, and appalled, actually very angry that this had happened. And then when I found out how it happened, I was just really disappointed that someone would do that, and that someone was able to just do that so fast without a conversation or anything. I started off contacting my service coordinator who works with me with my healthcare and things like that. I contacted them, and then I contacted my old supervisor and expressed my concerns and my outrage for these type of actions that happen to me.
I go to a particular healthcare provider. I go to Chase Brexton here in Baltimore, and the staff has been they've been compliant, they've been they're very competent when it comes to transgender terminology. They make you feel very comfortable when you come in. And even when one of the healthcare providers noticed that it had male on my identification, and she knew that I identify as female, she immediately stopped what she was doing. And she made calls over to records and had them corrected on the forms so that everything matched, so that insurance wouldn't be a problem, because she noticed that, even though my name and everything matched, that my gender identity on my insurance and on the forms weren't matching. And she immediately, and she was just a regular office person, not even one of the medical providers or nurses. And so she instantly went and corrected that. When you first go to the hospital, the emergency room, it's always been the issue of like, when is your period? That's always the question that always works me so terribly, because once they do that, then that's when I get buckled up and I can't really answer it because I don't have a period. And so that like freaks me out. Like, that's why I hate to go to the emergency room, or the question part, the triage, when they ask me, when is your first period? Because then I have to initially tell them, and I don't want to have to tell the triage person or whoever, because that person is maybe on a different level, and I don't know about like how they're, them basically talking amongst each other and whispering, doing the whispering, opposed to when you tell the doctor, it's not going to be like, it's not going to be that type of situation. So that is what makes me really feel uncomfortable going to the doctor, is that initial question of, when is your period?
Well, it's taken quite a long time for me to find medical professionals who were competent and who were willing and really wanting to know more about trans and gender nonconforming health. In my past, one instance when I went to the doctor's office, I came in, brand new patient. The doctor's office staff didn't really greet me very warmly. First of all, the doctor's office wasn't known for trans health. It was sort of something on the side that he did. And so when I came in, it was already a stressful feeling to come in knowing that the doctor's office wasn't really specifically for me. It was just sort of, you can also come if you keep it under the rug a little bit. So already I was feeling a little distressed about that. The staff were not warm, just kind of like glanced up at me, yeah, how can we help you kind of thing. Didn't really make me feel welcome at all. So just starting out in that way, that adds to the stress and the anxiety, that added to the stress and anxiety for me coming to the doctor's office, and knowing that, I wasn't really coming into a place where they were celebrating who I was. I was coming to a place where I kind of still needed to hide a little bit, just in order to be seen. So at that time, my ID, my driver's license, still said female on it. And so I had to kind of, under my breath, hushedly try to explain to them, I'm here as a trans patient. I know that my ID still says female on it. I identify as male. And since the staff really didn't understand what I was saying, or really try to understand that, it was more of just sort of like leering looks, like, well, what do you mean? you know, who is this in your ID? Obviously, I looked a bit different than I looked when I had my ID picture taken. So trying to explain that in the front office window when you have other people sitting behind you, it's kind of difficult. It's difficult. That made me feel like I wasn't valued. It made me feel like they weren't ready to help me in any way, in any real way. And it made me feel like I didn't want to come back to the doctor, that I would just kind of risk, you know, my health in order to just stay feeling like I could be myself. In that instance, I didn't feel that I was a valued member of that society. So I didn't want to come back to the doctor at all, actually. Part of the concern for me was, you know, disclosing my identity in a place where it didn't seem like they were really familiar with anything having to do with my identity at all. And what the impact of that would be, you know, not only in that immediate environment, people sitting behind me not knowing how they are going to react to a trans person being in the room, or knowing, you know, my business necessarily, but also, you know, what impact is that going to have down the line? Is that if this is how I'm being treated now, if I do have a serious, you know, medical emergency, can I count on this doctor's office to really be there to help me? I didn't feel confident in that. And so that relates back to what I was saying about not wanting to come back to the doctor, which is always a risk, because if I need something, or if any trans or gender nonconforming person needs medical attention and they feel that they can't even go to their doctor, they're risking their health in a major way.
It does something when I think that the staff, the healthcare doctors and staff doesn't realize that it puts a negative notation on for any other for any other transgender women, because, you know, it's a small community and we're mostly close and know of each other. So of course one person is going to tell the next person, guess what happened, and things like that. And that makes other girls not even want to go there to receive health care or anything. And that can make a person want to go to find street ways to get their hormone therapy, or not even want to go back to the doctors for any type of treatment.
I know that I can't procreate the same way as a cisgender woman due to reproductive organs. And so when they ask that, it creates a stronger dysphoria, like I just instantly, like, you know, because it's the one thing that I'm lacking in my transition. And so when they ask that, it just brings this dysphoric feeling. I've had like a urinary tract infection. And then it's like, they'll be like, get undressed for the exam. And I just feel like you need to be able to choose, like, if you want a male doctor or a female doctor, like when they do that part of the exam, because they might like do a urethral specimen test. And if you are someone who's still intact or pre-op, and you might not want someone touching your genitalia a specific way. And when it's very uncomfortable. That was uncomfortable for me.